Chronic care management essentially unburdens a physician. It frees you up to practice as a doctor, old school style. In modern medicine, and the way things have come around these days, there's so many things that you have to deal with that it just takes away from the original core of being a doctor.
So when CMS rolled out with the CCM program, we said, you know what, that this is an opportunity for us to help the doctor provide end-to-end care to their patients and also help them generate more revenue.
It's nice to know that there's a whole program designated just for taking care of the patients in between visits.
EHI is a very intuitive system. It makes it very easy for physicians to identify eligible patients and sign them up for CCM in one easy step.
Once the patient's consent is in the system,
That's when we take over.
Our nurses call the patients monthly, and they're available 24/7. Sometimes the patients actually reach out to the nurses more often.
I've been having a lot of patients reach out to me. We want to make sure they're up to date with their medications and able to take care of themselves. It's not just call the patient and say, hi, how are you? Is everything good? It's more than that.
We make care plans for every disease.
The physician can take that, use it to the extent that they need it, and tailor it to the extent that they need it.
that's when the personalization happens. But it starts from a care plan that is oriented around the disease.
So they can adjust, for example, the hemoglobin A1C to the level that they want for that patient. And a physician's trained to do these things, but it'll help a physician just kind of keep on track, make sure all these points are set so that nothing is missed with this patient. And it's just a smooth flow from visit to visit.
As a patient in their age bracket, they're sometimes comfortable in speaking in their own language. So we have nurses that speak many different languages, from Spanish to Hindi, Gujarati, and Arabic. We have many different languages to make the patient at ease.
Once having done the CCM services,
The nurses will document it in the care notes.
We've actually had doctors that have called and told us that it was great that I was able to go back and look at the care notes that the nurse had reached out to, because now I know that, okay, for instance, the patient was in the hospital for 3 days last month because of this. So when she comes in for her follow-up visit, I'm able to talk to her about that.
They'll know how the patient is doing in between the visits.
Sometimes it's like, where's the note from this physician, or where's the note from this specialist, or why weren't they seen last week for this reason? And it wouldn't have been anyone's fault other than there's just so much that was going on with this patient that somewhere it was just dropped. Now we have the resources with chronic care management. And the physician will get to the point where it's like, okay, I know this patient's immunization records are going to be updated. You'll just look at the chart, like, okay, these medications have been taken, these medications have been reconciled. This patient went to this physician and a medication change was done, and I know that I can rely on this medication list. Bottom line, CCM helps patients, it helps the physician, and it helps the system.